Okay, I'm going to go ahead and admit everyone in, and you can begin.
Great stuff. Good morning, good afternoon, everyone. Thanks for joining today's webinar on cybersecurity in healthcare and patient safety issue. I'll just give people another minute or so. Okay, we'll get started now. So today's webinar is about how cybersecurity affects patient safety. I'll talk about some of the risks as well as the opportunities available to attackers that are unique to healthcare. First, a little bit about myself. My name is Stuart Crotach. I'm part of the Novacoast attack team. We conduct various types of pen tests. These are mainly focused on, for me, it's mainly focused on healthcare organizations. I have presented talks and authored blog posts, as well as authored and co-authored a few white papers on the subject. I've also been known to purchase the odd medical device from places like eBay, conduct research on those, as well as on some open source healthcare software. Off the back of that, I've been able to develop custom tooling for interacting and attacking healthcare protocols. Prior to all this, I've worked in various roles in IT over the past 16 years. So, a shift in perspective. Originally, the cybersecurity in healthcare organizations was seen as an IT problem. This hasn't been the case for a while now. It is widely recognized as a patient safety problem, and it can incur significant enterprise risk. So the negative impact of a cyber attack could be devastating, almost akin to a regional disaster, as the effect doesn't only on the targeted organization, but it can also be on the surrounding healthcare organizations that then need to take on extra patients as a result. Healthcare will continue to be targeted due to the financial appeal of patient data to criminals, but cybersecurity isn't just a failure in cybersecurity failure isn't just a data loss event. It is a clinical safety hazard and can be catastrophic financially. So healthcare holds the highest average data breach cost of any sector. Studies have now directly linked cyber attacks to an increase in patient mortality, morbidity, as well as longer recovery times. Regulatory fines do show an upward trend, and civil lawsuits could reach a point that are extremely detrimental to organizations and people's livelihoods. So one of the key aspects to a cyber attack is the clinical risk. So the reliance on technology means that any downtime has the potential to cause patient harm. The appointment cancellations and delays in care will have a negative impact on patient outcomes. So depending on the urgency of the care needed that can't be given, or at least given as optimally as possible, can be attributed to the patient deaths and increase in morbidity. There are also secondary harmful effects from personal medical data being leaked. Could be ongoing psychological harm from information revealing stigmatized conditions. This could also include a reduction in trust, which means that patients may omit certain details when they seek medical care, or they may even avoid seeking medical care at all. One particular attack that stuck in my mind was the Vastamo attack in 2020. This is a Finnish psychotherapy organization. So the attacker tried to extort the company after obtaining the data on their patients. The company refused, and then the attacker resorted to extorting the individual patients themselves. The company had something like 33,000 patients, and that included children as well. So there's moving on from there, there's the operational strain from reverting back to backup systems like paper-based systems. That's even if they exist. You're then dealing with the backlog once those systems are back up. So the HSE in Ireland, so the National Health Service there, back in 2021, suffered a ransomware attack. This is a national organisation, so quite large, but it took 4 months to decrypt all servers from the time of the first reported encrypted server. Even though it was a large organisation, they were already experienced in crisis response due to COVID, and they had assistance from Defence Forces and the NCSA. Moving on to the financial fallout from data breach. So the IBM Annual Cost of a Data Breach Report 2025 states that the average cost of healthcare data breaches remains the highest among other industries for the 12th consecutive year. The global average cost of a data breach is roughly $4.5 million. However, the average for healthcare is closer to $7.5 million. That's even after falling by 2.3 million from the previous year. I mean, reasons for this can include, the higher regulatory fines than other countries, loss of business from downtime. Healthcare was recorded as being the longest to identify and contain breaches at 279 days, compared to the global average of 241. There's also the potential of reduced investment in security spending and aligning with security frameworks. However, that was US specific. Globally, it was actually the opposite. Then there's the regulatory side and liability. This can include civil violations. It can range from $100 to $50,000 per violation, with reaching a maximum of 1.5 million annually. So again, these are all specific to US. So this can range from an individual who unknowingly violates HIPAA through to a violation due to willful neglect that is not corrected. So imagine, for example, there's a server that needs to be up all the time, but due to a new vulnerability existing, it not being patched. That could be something considered like that. There's also the criminal violations, and these range from, say, $50,000 to $250,000, but they also include the potential for prison time, and that ranges from 1 to 10 years. There could also be further financial loss from any following lawsuits and loss of patients if they have eruptions through the reputational damage. So where does pen testing come in to help with this? Well, first, we need to understand the difference between enterprise and medical IT. So pen testing enterprise networks typically comprise of the same groups of technology. You'll often see servers and user devices, IP phones, cloud resources, network devices. They'll be running things like Active Directory or web applications, file servers, and databases. And we'll commonly see things like operating systems such as Windows or Linux. As such, the standard testing methodologies and tools and tactics for all these are well documented. And to an extent, vulnerability research is heavily focused on these due to the widespread usage and the impact that can have. Now, in healthcare environments, it includes all that technology found in enterprise environments, plus the same again, if not more, in healthcare-specific technology. The healthcare-specific technology can be things like electronic health records, PACS, which is picture archiving communication systems, so medical imaging. You have ambulatory systems, pharmaceutical labs, all those kind of things. And this massively increases the attack surface due to the size and variation in those systems and devices present on the network. And it offers novel approaches to attacks. So SANS reported the PACS viewer, so medical imaging viewers, were being used to deliver malware. And my absolute favorite piece of research that I've read to date comes out of Washington State, where in a controlled environment that was purposefully created to and introduced a vulnerability in a lab where they embedded malware in DNA that was then processed by a gene sequencer and ultimately compromised the device. So it just shows that the breadth of additional avenues of attack that exist. And although that last example in particular requires a niche set of skills and hefty resources, it can be much simpler to demonstrate significant impact. So using those different tactics and methods that don't necessarily mean looking for or require gaining high privileged users as you would in an enterprise environment. And it could be as simple as just being available on the network and seeing traffic on the network. So this includes the standards and protocols that you'll see and are unique to healthcare. So we've got things like HL7v2, which is a clinical messaging standard, DICOM, which is for all the medical imaging, ISO2, T1, these are for laboratories, systems, and point of care. And then you've got FHIR, or Fast Healthcare Interoperability Resources, which is a modern web API. Now, not including FHIR, the first 3 or 4 there, these are only just snippets as well. There are many more of this. There are little in way of safeguards for these. A lot of them are unencrypted, and which means that they are any of these interfaces sending that information is in clear text on the network. So if the environment isn't well segregated, then just being present on the network means you'd be able to extract protected health information. So no compromise needed, just plug your laptop into an exposed port, or even worse, if there's Wi-Fi that isn't well segregated, then you could just connect and you wouldn't even have to be in the building to do that. From an external perspective, so these 2 screenshots here are from Shodan, which is a search engine for devices connected on the internet. This is available to anyone, free of charge. As you can see here, there's 2 screenshots, and I've searched for DICOM, which is the medical imaging thing protocol. The image on the left there is from October 2024, and you can see there's 5,500 devices there accessible on the internet. And on the right is a screenshot from the same search in October 2025. So in a year, we become less secure overall. Now, it's not to say that all of those devices will be easily exposing medical images, but it's almost certain that they will, that some of them will at least. Now, in 2020, some French researchers did exactly that and found that they were able to access 45 million medical images. And this was either through unauthenticated means or using default credentials or details that are found on publicly available documentation. So then there's, again, this is only a small snippet of what's available, but the medical technology. So we've got the EHR, which is the electronic health record. This is what most people will be familiar with, or at least heard of. And this is where patients' health records are consolidated. It's not necessarily where all the information is generated. These can come from the things right with that. So the information systems, and these can include radiology information system, laboratory information system, hospital information, hospital management information system. Basically, any department will likely have an information system, and that feeds data into the EHR. We've also got something called an integration engine. And this basically facilitates communication between devices and systems that wouldn't otherwise be able to. And then further down the chain, you have the medical devices themselves. Now, there's a vast array of these. They also vary widely in scope and, for example, size and functionality. Depending on the function of them as well, they could be in service for 15 plus years. It's not very often that an MRI machine is updated or renewed. So thinking about access to patient data, the EHR is usually the place that people think about the most. However, these, especially from companies like Epic and Cerner, providers of these, they can be fairly well protected, providing decent password requirements, multi-factor authentication. But as I said, it's not the main source of all the patient data. And so we need to think about how well protected are these other systems. For example, the integration engine. Previously, we managed to log on to these using default credentials, and they will contain information that includes PHI, but also connection details to, say, databases. And that might even include the database to the EHR. So the support and technology, again, thinking about how things affect patient safety. There are other systems in any facility, and if these are affected, they could impact negatively. For example, HVAC. If you're, if you have an aging population in your building, and it's say the middle of winter, and you're unable to heat the building, that could have a serious negative impact, especially at risk patients. And if things like refrigeration go down and that's all the blood, drugs, and lab samples, suddenly they're no use. And further down on the scale as well, you've got things like lifts. So if they go down, how does that impede internal patient transfers? For example, going from a ward to like surgery or things like that. And then lighting. So in most major facilities, there will be backup lighting, but these may be not as effective as normal lighting, which could increase hazards such as falling. So closing thoughts on here is that the underlying goal for any healthcare organisation is to care for their patients. So healthcare testing requires a shift in mindset, and this needs to focus on how these vulnerabilities and affect patient outcomes. So we can rethink penetration testing as a tool for improving patient safety, not just identifying vulnerabilities in areas of technical risk. All devices and systems should be assessed at some point. Now, it may be that there are older devices on there or devices that can't be tested at a certain point in time. So we can use different methods. For example, if we could talk about continuous pen testing, which we've also provided a webinar on this previously. We could also use things like tabletop exercises or testing in dev environments. For example, if it's too risky to do active testing on certain older devices or they're currently connected to a patient, we don't want to cause those devices to go down or crash through the activities of a pen test. And finally, I would say probably the most important thing is to include a clinical professional in the testing cycle. So this would be a healthcare professional who understands technical risk enough in order to translate that into how it would impact patient safety. And that just helps prioritize remediation tasks. Okay, and that is it. If we have any questions.
If there are any questions, you can enter them into the chat and he can answer them for you.
No, that's fine. If there are any questions or anything needs clarifying further down, please feel free to reach out. And thanks for joining.